Last video we left off with a psychiatrist discussing what nutritional psychiatry is. And as I said, I would disagree somewhat in the sense that I believe nutritional psychiatry also involves orthomolecular medicine and the ability of orthomolecular medicine with the use of supplements to meet people's individual needs for micronutrients and macronutrients, etc. But let's continue. I'm going to recap by putting that guy on again so people understand where we're coming from right here.
Part of the thing about nutritional psychiatry is really thinking that all the data right now that's really strong is about augmenting treatment. It's kind of what we do in my clinic, the Brain Food Clinic. It's also really in my new book, Eat to Beat Depression and Anxiety, kind of how I try and talk about it, that when you think about beating depression and anxiety, there are lots and lots of things when you see someone do that they bring to the table. Even if people have a response to medications, or even if really psychotherapy helps them, when really people kind of get into full remission from an illness, they're often marshaling a lot of different aspects of their life. Their sleep hygiene's improving, their relationships usually are improving, and nutrition is kind of one really important aspect of that. And so the data has come out, it's been really interesting. It started out with correlational data showing that populations that eat a dietary pattern that's more Mediterranean style, or another way to put that is just what's called a traditional dietary pattern. So if it's a Japanese diet or a Norwegian diet, just diets that are made of more whole, unprocessed foods, folks tend to get less depression and less anxiety.
So this is from the World Health Organization. Okay, so micronutrients are vitamins and minerals needed by the body in very small amounts. However, their impact on the body's health are critical, and deficiency in any of them can cause severe, even life-threatening conditions. This is why people really do need to look into the triage theory of aging and disease by Dr. Bruce Ames. Okay, so they perform a range of functions, including enabling the body to produce enzymes, hormones, and other substances needed for normal growth and development. Deficiencies in iron, vitamin A, and iodine are the most common around the world, particularly in children and pregnant women. Low and middle income countries bear the disproportionate burden of micronutrient deficiencies. Micronutrient deficiencies can cause visible and dangerous health conditions, but they can also lead to less clinically noticeable or less clinically notable reductions in energy level, mental clarity, and overall capacity. So keep that in mind. We're thinking about mental health here, right? So micronutrient deficiencies can also cause reductions in energy level, mental clarity, and overall capacity. Okay, so they can cause low energy level, depression, lack of mental clarity, delusional thinking. Okay, they can actually cause outright psychosis. But going further, this can lead to reduced educational outcomes, reduced work productivity, and increased risk from other diseases and health conditions. So keep in mind, these are physical health conditions also. Many of these deficiencies are preventable through nutrition education and consumption of a healthy diet containing diverse foods. Okay? And also with food fortification and supplementation. So the fact sheets here, what's a healthy diet? A healthy diet helps to protect against malnutrition in all its forms, as well as non-communicable diseases, including diabetes, heart disease, stroke, and cancer. Unhealthy diet and lack of physical activity are leading global risks to health. Healthy dietary practices start early in life. Breastfeeding fosters healthy growth and improves cognitive development, and may have longer-term health benefits, such as reducing the risk of becoming overweight or obese and developing non-communicable diseases later in life. Energy intake, or calories, should be in balance with energy expenditure to avoid unhealthy weight gain. Total fat should not exceed, this is from what they're saying, total fat should not exceed 30% of total energy intake. And these numbers are about right for the average person, maybe not the athlete, but about right for the average person. Intake of saturated fat should be less than 10% of total energy intake, and intake of trans fats less than 1% of total energy intake, with a shift to fat consumption away from saturated fats and trans fats to unsaturated fats and towards the goal of eliminating industrial-produced trans fats. Limiting intake of free sugars, meaning table sugar and sugar added to refined foods, to less than 10% of total calorie intake or energy intake is part of a healthy diet. A further reduction to less than 5% of total energy intake is suggested for additional health benefits. Keeping salt intake to less than 5 grams, meaning less than 2 grams of total sodium, may help reduce the risk of heart disease. World Health Organization member states have agreed to reduce the global population's whatever. Overview: consuming a healthy diet throughout the life course helps to prevent malnutrition in all its forms, as well as a range of non-communicable diseases. Okay, however, increased production of processed foods, okay, so keep this in mind, increased consumption of foods made in factories, rapid urbanization, and changing lifestyles have led to a shift in dietary patterns. People are now consuming more foods high in energy, fats, free sugars, and salt and sodium, and many people do not eat enough fruit, vegetables, and other dietary fibers such as whole grains. The exact makeup of a diversified, balanced, and healthy diet will vary depending on individual characteristics, age, gender, lifestyle, and degree of physical activity, cultural context, locally available foods, and dietary customs. However, the basic principles, and I've gone over this in many videos, the basic principles of what constitutes a healthy diet for a human remain the same. Okay? Fruit, vegetables, legumes, nuts, and whole grains, unprocessed maize, millet, oats, wheat, and brown rice. Okay, so keep that in mind. Whole grains, unprocessed corn, unprocessed millet, unprocessed oats, wheat, and brown rice. At least 400 grams of fruit and vegetables per day. Less than 10% of total energy intake from free sugars, which means added sugars, for a person of a healthy body weight consuming about 2,000 calories per day. But ideally less than 5% of energy intake. Probably get it down to 0%, but yes, less than 5. Free sugars are all sugars added to foods or drinks by the manufacturer, cook, or consumer, as well as sugars naturally present in honey, syrups, fruit juices, and fruit juice concentrates. Less than 30% of total energy intake from fats, unsaturated fats found in fish, avocado, and nuts, and in sunflower, soybean, canola, and olive oils are preferable to saturated fats. They are preferable to them. Saturated fats are things like fatty meat, butter, palm oil, coconut oil, cream, cheese, ghee, and lard. And trans fats of all kinds, including both industrial-produced trans fats found in baked and fried goods and prepackaged snacks, and foods such as frozen pizza pies, cookies, biscuits, wafers, and cooking oils and spreads, and ruminant trans fats found in meat and dairy products from ruminant animals such as cows, sheep, goats, and camels. It is suggested that the intake of saturated fats be reduced to less. So I bet people didn't know that. Some trans fats actually do occur in nature. They occur in ruminant animals, okay? But you should reduce this saturated fats to less than 10% and try to eliminate trans fats to less than 1%. So get it just out of the diet. Less than 5 grams of salt a day, equivalent to about 1 teaspoon, okay? Salt should be iodized, and that's going to be important later, okay? For infants and young children in the 2 years of a child's life, optimal nutrition fosters healthy growth and improves cognitive development. It improves cognitive development. Remember how I said a lot of psychiatric issues involve a cognitive component, okay? So it reduces the risk of becoming overweight or obese and developing non-communicable diseases later in life. Advice on a healthy diet for infants and children is similar to that for adults, but the following elements are also important. Infants should be breastfed exclusively during the first 6 months of life. Infants should be breastfed continuously until 2 years of age and beyond. From 6 months of age, breast milk should be complemented with a variety of adequate, safe, and nutrient-dense foods. Salt and sugar should not be needed to complementary foods. Practical advice on maintaining a healthy diet. Eating at least 400 grams or 5 portions of fruit and vegetables per day reduces the risk of non-communicable diseases. Fruit and vegetable intake can be improved by always including vegetables in meals, eating fresh fruit and raw vegetables as snacks, eating fresh fruit and vegetables that are in season, and eating a variety of fruit and vegetables. Fats. Reducing the amount of total fat intake to less than 30% of total calorie intake helps to prevent unhealthy weight gain in the adult population. Also, the risk of developing non-communicable diseases is lowered. Reducing saturated fats to less than 10% of total energy intake. Reducing trans fats to less than 1% of energy intake. Replacing both saturated fats and trans fats with unsaturated fats, in particular with polyunsaturated fats. Fat intake, especially saturated fat and industrial-produced trans fat intake, can be reduced by steaming or boiling instead of frying when cooking, replacing butter, lard, and ghee with oils rich in polyunsaturated fats such as soybean, canola, corn, safflower, and sunflower oils, eating reduced-fat dairy foods and lean meats, or trimming visible fat from meat and limiting the consumption of baked and fried foods and prepackaged snacks and foods, such as donuts, cakes, Sodium and potassium, you got to keep this in balance. So most people consume too much sodium through salt and not enough potassium. High sodium intake is insufficient. Potassium intakes and insufficient potassium. So high sodium intake and insufficient potassium intake contribute to high blood pressure. So keep that in mind. It's about a balance. High sodium intake with low potassium intake can contribute to high blood pressure. Reducing salt intake to the recommended level of less than 5 grams per day could prevent 1.7 million deaths per year. Okay, salt intake can be reduced by limiting the amount of salt and high sodium condiments. Okay, not having salt or high sodium sauces on the table, limiting the consumption of salty snacks, and choosing products with lower sodium. Okay, consuming free sugars increases the risk of dental caries, meaning cavities. Excess calories from food and drinks high in sugar also contribute to unhealthy weight gain, which can lead to overweight and obesity. Recent evidence shows that free sugars influence blood pressure and serum lipids and suggests that the reduction in free sugars intake reduces risk factors for cardiovascular diseases. Sugar intake can be reduced by limiting the consumption of foods and drinks containing high amounts of sugar, such as sugary snacks, candies, sugar-sweetened beverages. Eating fresh fruit and raw vegetables as snacks instead of sugary snacks. Okay, how to promote healthy diets. Now, before I continue, I want people to know, I'm not a physician. Okay, I'm not a DO, an MD, an ND, a chiropractor. I'm not an LPN. I'm not an RN. I'm not a nurse practitioner. I'm not a dietitian. I'm not a nutritionist. This video does not constitute any type of medical advice. None of the videos on this channel do. So before I continue, let's move on here. So diet evolves over time, being influenced by many social blah, blah, blah. Okay, I'm going to go over this later, but let's move on here. So traditional diets tend to be anti-inflammatory, but let's talk a little bit here about the effect of nutrition on mental health, a focus on inflammatory mechanisms. Neuropsychiatric disorders are closely associated with a persistent low-grade inflammatory state. This suggests that the development of psychopathology is not only limited to the brain, but rather involves an additional systemic aspect, meaning the whole organism is involved, accounting for the large body of evidence demonstrating co-presentation of mental illness with chronic inflammatory conditions. So keep that in mind. There is a large body of evidence showing mental illness presenting with chronic inflammatory conditions and metabolic syndromes. Studies have shown that inflammatory processes underlie the development of neuropsychiatric symptoms. Okay, with recent studies revealing not only correlative but causative relationships. So not just correlative, but there is a causative relationship between the immune system and psychopathology. Okay, lifestyle factors such as diet and exercise may influence psychopathology, and this may occur via bidirectional relationship. Mental illness may prevent health-seeking behaviors such as failing to maintain a balanced diet whilst adopting a healthy diet rich in fruits, vegetables, and fish. Alongside nutritional supplementation correlates with reduction. So nutritional supplementation correlates with a reduction in psychiatric symptoms in patients. Obesity and gut microbiome have proven to be further factors which play an important role in inflammatory signaling and the development of psychiatric symptoms. In a related paper, we focus on the people that wrote this focus on the role of exercise, another significant lifestyle factor on mental health. Okay, so let's see here. Lifestyle modifications which target diet and nutrition may prove therapeutically beneficial for many patients, especially in treatment-resistant subgroups. The current evidence, which everybody is in a treatment-resistant subgroup in the sense that if you really think about it, who the hell gets better that's getting mental health care? Not many. The current evidence base provides equivocal evidence. However, future studies will prove significant, blah, blah, blah.